this is only my second live stream so far this year. So yeah, it's looking at probably every 2 weeks or just more ad hoc, because the main bulk of the information on here is going to be my recorded videos. So I'm trying to do 3 videos a week, but you'll definitely get at least two videos uploaded each week. So if you're watching this for the first time, my name is Marianne Hanson. I'm the counsellor and the owner at Marianne Hanson Counselling Service. Any information on this page really is more just giving you information through videos. You can also find me on Facebook with the same name, Marianne Hanson Counselling Service. You can find me on TikTok and on Instagram, and I'll put in the descriptions normally where you can find me, or sort of what my names are on those places. So this is just going to be, I'm not going to make it too long, but it's just talking about a simple question which doesn't have a straightforward answer, and that is, what is therapy? And the reason I thought I'd make this video is because it's probably going to be useful for quite a lot of people who have either considered going to therapy or have been to therapy and have no clue what happened, or what it was all about. And it's just to really put a few ideas from my perspective on what I believe therapy is as a therapist, from a therapist point of view, but also to give you guys some ideas. So anyone that joins live, please feel free to leave your comments. Leave your comments if you feel comfortable talking about your own experience of being in therapy, or you can just drop a comment about what we're discussing. So thanks for joining. I can see people joining. So the first description that I would give of what therapy is I've put down, it's a professional undertaking with clear boundaries, with a professional who has skills, knowledge and expertise in their field. And also it's the other part of it is the client is sharing their story. So the client owns the material. So I know a lot of people sometimes will think, well, the counsellor has the authority, the power, the counsellor is the one that leads, the counsellor is the one that decides. But really the client makes the decisions in therapy, because the counsellor doesn't know anything about the client. The client has to then chooses what they share and what they don't share. So the client really holds the power, because if a client doesn't share certain information with you, you can't sometimes do the work in a deep way. However, if they share certain bits of information with you, then you can still do the work. But that's why I think the client holds more of the power, because the client decides what they share and what they don't share. The client uses the space in whatever way they want to, and that's how it should be. Because it's the client's space, and that's because the client should decide what they want to share, what they don't want to share, how they want to use therapy. To a certain extent, it still is a professional undertaking. So the reason I've put that in there is because when you go to a professional, whether it's a doctor, a psychologist, a counsellor, you as a person, a client coming to see those people, you have an expectation that they're going to have some skills, some knowledge, some expertise, and that someone somewhere has done certain checks to make sure that they are who they say they are. So I know that places like BetterHelp, for example, where I've been on there for 2 years. Was it 2023 I joined BetterHelp? I've been on and off, so I've joined, then I've left, then come back. There's over 17,000, I think, counsellors on there, probably more than that actually, worldwide. So there's counsellors from all over the world. They definitely do checks, so they make sure you have the right qualifications, they make sure you have the right insurance and all the rest of it paperwork wise. In terms of the type of counsellor you're going to find, not just on BetterHelp but anywhere really, it's hit and miss. And I'm saying that because not only do I supervise trainee counsellors, so I've got experience of being a supervisor and seeing the type of people that are coming through and becoming counsellors, but also you've got people who are your peers as well. So maybe if I've been on training groups and stuff, so I get a good idea of like the calibre of people within this field. And I'm not saying I'm up there and I'm the best counsellor in the world, or I'm not saying I'm like the worst, but the thing is, when you're setting up, when you're putting yourself out to receive a service, you have expectations that it's going to be good, that it's going to be quality, that person is going to have taken some level of training, that person is going to be checked by like the British Association for Counselling and Psychotherapy. So that's why for me therapy is a professional undertaking, and most counsellors should recognise that. So the second thing really is that it's a space to identify, explore and understand feelings, understand patterns of behaviour, gain awareness and gain understanding of self. So let's look at a few of these things in a bit more detail. So if you go to speak to a counsellor and you sometimes have either 50 minutes or sometimes you'll have an hour, that's usually the counselling time. In some cases people have said they have 30 minutes, which is not very long, but the NHS sometimes does really short 30-minute sessions. The whole thing, for me, I see it as being you're gathering information, and the information is coming from the client. So the information is sharing information through their body language. They're sharing information through the words they're saying. They're sharing information through their stories. They're sharing information with you so that you can either do something with it or that you can understand them better. So I would prefer, I'm not saying prefer, that's the wrong word. When I have a talkative client, or I have a client who is clear on what they want to bring to therapy, or they've had therapy before, or they're very clear on explaining things. Of course, most counsellors have said that makes it easier. The reason it makes it easier is because there's clarity already a little bit. It doesn't make the work, the therapy, any easier, because you don't know when you're digging deeper and deeper, and when you're talking more, things that come up. The skill that you then have to have if you've got the opposite, which is someone who's never had therapy before, someone who doesn't really know what they want to get out of therapy, doesn't have a goal, but knows they need to be in therapy, that's where, like I've said, the skills, the knowledge comes in. Because what you're trying to do is explore someone's feelings, but maybe someone isn't comfortable talking about their feelings. You're trying to put patterns together and link things together. So the client might say, I struggle in all of my relationships. So that's their blanket thing. So even if they don't know what they want to explore in therapy, that is still them giving you enough information that you can do some really good work there. You can talk about communication style. You can talk about all the different relationships they have with different people, and you can try as a counsellor then to help them identify patterns. Are you a people pleaser? Is that why you struggle? Have you had struggles with childhood stuff? So that's why it's hard for you to relate to people on certain levels. Whatever it is, you're working with the client there because they're giving you information. You're taking that information, you're digging a bit, asking a few more questions, and together you're working to try to understand and to try to explore patterns and their behaviour. The second part is about gaining an awareness of themselves. So if someone is in therapy and they've been speaking to a counsellor for 3 to 6 months and they don't feel they have any clearer understanding of who they are, then to me the counsellor hasn't done a good enough job. That's the bottom line. The counsellor hasn't done a good enough job, because the longer you're in therapy for, even if you're speaking to your counsellor weekly, fortnightly, should be some levels where you are understanding. It should either be, you're not going to get a light bulb moment in every session. You're not going to walk away and think, I'm now know everything about myself, I understand myself. But the counsellor should be the one that's helping you to gain better self-awareness, even if the self-awareness is, I recognise now that the reason I am this way in my relationship is because when I was a child this happened. The counsellor might need to put that together for you. It could be, I recognise my self-awareness is that I am too needy, or that I have this type of attachment style. Because when you're talking in therapy, the intervention from the counsellor should be that they are picking up on things, they're providing an intervention and a response that fits with what you've said, but then they're also looking at the bigger picture and looking at you as a person and thinking, what is it that you need out of therapy? Do you need to understand yourself better? Do you need to improve your relationship? Do you need this? Because not everyone is going to be able to articulate what they need, but through the conversations that you have, if you work with a good counsellor, you come to it. I mean, some of my, and this is why for me it's so interesting, because I do short-term work and long-term work, and it's so different. With short-term work, you can't build a relationship deeply after just 6 sessions. But what I like about the 6 sessions is that both parties go into it knowing you've only got a limited amount of time. So what I've found when I've worked with clients just for 6 sessions is they've gone in with the attitude of, I need to get everything out of each session. The sessions are quite intense, and you don't build as much, as I said, relationship, but you get the work done. I've found that I've got really good outcomes from the 6 sessions sometimes, because we're both going in there with the idea that we need to make every session count. The other side is with long-term clients. So when I'm on BetterHelp and I've been working with, I was looking today, I've worked with some of my clients for 6 months, I've worked with some for 7 months. Each time you meet with them, because it's weekly as well, you learn something new. And it gets to a point where after 6 months, you and your client are just in sync in a certain way, but then other times it doesn't work like that either. You can get to 5 months or 6 months with a client and still not know them at all. But the relationship is still there, because there's no way the relationship isn't going to be there, because they've seen you every week for 6 months. So that's the difference. And either way, if you're a good counsellor, you can navigate any of that. You can navigate the first time you meet with your client. You can build rapport after the 6 weeks. You can build rapport after like 6 months together. That's how it should be in a way. So that's why when we're looking at what is therapy, therapy is a process. You know, each time you meet your client, you don't assume that just because last week they were talking about this thing, this week they're going to talk about the same. You don't assume that you know them better than they know themselves. You know, there are some counsellors that think they know the client better than the client. I don't ascribe to that. I think the person knows themselves quite well, but sometimes they don't believe that. So the other thing that counselling is, so as I've said, it's a professional undertaking where there's boundaries. There has to be boundaries there, where there is a person who has knowledge, expertise in the field, and where the client is the one that holds the power, because they have the story. They can share bits, they can hold back other bits, and that's how it should be. So the third thing is, it's a place to be challenged in a supportive way. If you don't take risks in therapy, then where are you going to take the risks? Because therapy is the safest place to take those risks. And what I mean by that is, for therapist and counsellor, taking a risk means that sometimes as a counsellor you challenge your clients. So someone on BetterHelp, they sent a testimonial or what's it called? Yeah, a review, review or feedback. And they said something along the lines of, Marianne is direct, but in a supportive, gentle way. Or Marianne challenges me to think differently from things that I wasn't thinking about myself. And I like that, because to me, your client is going to remain stuck if they come to counselling and they want to be pushed in a certain way, but not in a way that is you saying, right, now you need to talk about your childhood, now you need to talk about this, or you're not leaving this room until you do this. It's not about that. But sometimes if your client is stuck in patterns of doing certain things or saying certain things, so a good example where I challenge, because one of my specialist areas is low self-esteem, if a client continuously is putting themselves down, or they're constantly saying, you know, I'm not good enough, and that's how they feel. So I'm not going to say to them, you don't feel like that. And I'm also not going to give them a pep talk saying, you know, tell yourself you're beautiful or do affirmations. That's not what they need. But I might challenge where that comes from, but I also might challenge if the person feels more comfortable with the negative thoughts than they do with the positive ones. Now, that's where you are taking a risk, because you're saying to your client, you know, do you feel comfortable in this place? And it's not a good place where they're in. But what you're trying to help them to see is that if you get out of that comfortable place, it's going to be scary, because, you know, when you have to accept compliments or when you are saying nice things to yourself, that's going to be scary. But that's where you need to go in order to get out of that place. So your counsellor, I think before you challenge, you do have to build a relationship first. And when you challenge, you have to do it in the right way. Some of my trainees that I supervise, sometimes they do get it wrong, but, you know, they're learning. I was a trainee counsellor once. And this is the thing, when you take a risk, you have to timing is everything, and also how you challenge. Because if you say to someone like, why are you always thinking that way about yourself? Or you might say, you're trying to figure out my accent. Why every time I do a live stream, someone talks about my accent? I haven't got a strong accent from, well, I think I have. Do you know, when I'm speaking to other people, I think I've got a Birmingham accent or a Midlands accent then. And every time people ask, they say, where are you from? Anyway, back to the live stream. So you need to challenge in a way where the client feels supported. Because if you've built up a really good relationship with your client and then you are challenging them, they might feel judged. Because if you say to them, well, you've been talking about your relationship with your partner, you say that you don't like getting into arguments, but could you be the one starting the argument? That is not a good challenge. But if you say, oh, hi, Arthur, good to see you. If you say to your client, when you're in conflict with someone, have you noticed any patterns? Have you noticed anything that you're doing that changes that dynamic? Then we get into it then, because the client might say, do you know what, when I'm having an argument, I can't walk away. Or when I'm having an argument, I need to be right. I need to resolve it right now. And then we do the work. The work then is about, what is it about that person that means they have to be in conflict or they can't avoid it. And then it could be an avoidant personality. It could be so many things. So do you see how like the difference between challenging someone in a gentle way but not judging them? So that to me is therapy. That's part of it as well. The fourth thing, so there's a few more things, is therapy is an opportunity to formulate or find answers or solutions. This is why it's important as well if you're going to therapy and you want having a therapy goal. Because if the counsellor doesn't know why you're in therapy or what your main goal is and what you want to get out of it, the intervention they might use might not suit you, but they won't know that. Because if you're working with a solution-focused way, which is sometimes how I work, or CBT, it is all based on outcomes and solutions, and it's based on finding answers and solutions. Whereas if someone knows that they're in a situation where there is no solution, so say they've had a relationship breakup, or they've had a bereavement, there's no solution to those things, but they might just want to talk and be heard and to feel. So the difference is you wouldn't use a solution-focused approach with someone who is trying to slowly recover emotionally from a breakup. So you probably use a different way of different method, but overall, the person is coming there to either improve something, to change something, to understand something, to find patterns or to find answers. If you put it into those categories, that's the most people come to counselling for. However, outside of that, someone could come just to talk. Someone could come to counselling because they've been told or that they need counselling. It could be because they've been ordered to attend counselling by like the courts or someone else. So there's lots of different reasons. But if you look at what we're talking about here about what therapy is, it's collaborative. It's not the counsellor saying to you, you're in counselling and you need to do A, B, and C. This is why, for me, it's beautiful, like therapy when it works. You have two people and you're not one person isn't leading the other person. There's two people talking to each other and you're finding out what it is that person wants, and you're both working together to get that. And it might not be the outcome that they've come for, because maybe they'll learn something about themselves and they'll think, oh, this is not what I was expecting. Or maybe the counsellor will challenge them and they'll think this is too much. There's been a few occasions where when a client actually clicks and realises, oh, it's not actually my partner that has to change, it's me. Not everyone is comfortable with that, because then that's when they have to do the work. And some people are like, well, I want to continue to blame the other person because that's easier. So you can find out, but then even that's good, because it means you can find out. You might then decide, you know what, I'm going to accept. Someone was on TikTok yesterday, similar thing. They were writing about, they were saying, it was this thread. The thread on TikTok was about people saying they've been in their relationship for many years and they feel like housemates. there's no intimacy, there's no relationship. Most of the people talking on that thread were saying, I want to leave, but I think this person might change, or we've been together so long, it would be a waste to leave, or they act like I'm their roommate. I've told them how I feel, but they're not changing. Or it's all near enough they were all saying the same thing. The main thing no one was saying on the thread was that I'm going to take some action to leave this person, or, you know, eventually I'm going to find the courage to leave, or has anyone got any advice on how to leave? There was none of that, because everyone was kind of caught on this thing of, I want the person to do something. As I've just said, like, sometimes people are stuck on external things or on people doing something, whereas in therapy sometimes it is about looking at yourself, looking inwards, because you've got more control over yourself than you have over anyone else or anything else. So opportunity to formulate answers or find solutions. Two more things that I'd say is, and one is that it's a collaborative effort. So the interventions in therapy, they might be coming from the counsellor, but good therapy means that you're working jointly, you're in sync, you're connected to your counsellor, there's rapport, there's trust. You know, there's days where you just want to talk and your counsellor is just there to listen. There's days where you need more than just to talk, you need answers. Your counsellor is never going to directly instruct you or tell you what to do, because that's not good therapy, and that's not what therapy is. But there's times where maybe you are struggling with, okay, I've been through this, I've talked about this a number of times, I'm stuck. And when your client is stuck, then they do want the counsellor to help them become unstuck. And that might be, okay, well, let's go back to when we talked about this last week, or let me think if there's a worksheet that might help, or why don't we talk about this, because this might be useful. You're only suggesting things, you're not saying, right, well, what we need to do is this, because you're not taking over this session. So the collaborative stuff as well means, this is what I've said earlier, that you come to do the work, which is the final point. You do the work outside of the therapy, you do the work in the therapy. Therapy is work. It's similar to a relationship. A relationship is work. And it doesn't mean that you don't have to put the word hard in front, hard work, but it is work. Most things are work. And this is what people like kind of struggle with sometimes. They come to therapy and they don't realise that it's going to take some effort. Maybe you've never talked about your feelings before. Well, this is the place to do it. And the point is, people then say or think, I don't want to do this. I don't want to be in therapy talking about my feelings. Well, you don't then need to go to talk in therapy, because there are things like art therapy, play therapy. There are different types of this online chat. There's 100 different ways that you can express your feelings, but if you come to talk in therapy, then you do need to talk, and that is where the work comes in. And then the work that you need to do outside of therapy is what you do when you're not in the therapist's office, and that is what you do outside. So because to me, that is when I see the most progress made, when people turn up and they do the work in therapy and they do the work outside of therapy. I'm not there watching them like in the 6 days they're not in therapy, but you can tell because each week they're turning up. They're different, and you're saying to them, I've noticed you're different with your words. I notice you're different with your confidence levels. So yeah, everyone's got their definitions of what therapy is and what therapy isn't. Everyone has, you can go on Google and get just a blanket definition. You can speak to 100 different counsellors that all have a definition. You can go on the BACP. To me, as I've said, it is a professional undertaking with boundaries where the counsellor has skills, knowledge and expertise. It's a space to identify, explore and understand feelings, patterns of behaviour and gain awareness and understanding of yourself. It's a place to be challenged in a supportive way. It's an opportunity to find or formulate answers or solutions. It's work, and that's doing the work in the session and doing the work outside of the session. And it's a collaborative effort with the counsellor and client being on the same page, being in sync, using interventions, and where the client feels heard, understood, but also gets what they need. So that's what I think therapy is. And thanks for joining. You got hair. Oh, I'm not. That's a rude title that you've got. I'm not going to say that. And then you've also got Arthur. So thanks for joining. Really appreciate you joining on the live stream. Anyone that is just jumping on now, you can watch the live stream. Leave your comments. Let me know what you think. And I'll speak to you all soon. Have a great week. Bye.